Okay, well, good morning, everybody. It's nice to see you all again for our second PK Shirley series on simulation. Well, hi, Sherry Rivera. I think she's connecting. So today we're going to go over the next two standards, outcomes and objectives in facilitation. And we sent you a handout with some SMART objectives. So we'll be talking about today. And if you had a chance to look at SMART objectives via the tool we sent out, great. If not, that's okay too. We'll be talking about that today. So are there any questions about the content from last time or any questions before we get started? Okay. All right. So next. Okay. Very good. So at the conclusion today, we're going to be able to create SMART objectives to achieve expected outcomes and evaluate facilitation needs based on skill level and learner needs, of course, in simulation, but SMART objectives and facilitation can be used in a lot of environments, but we're specifically, of course, honing in on simulation today. All right. So that was our little video snippet to kind of show you what we're going to talk about today, get our visual learners on board, and to show, some real life examples of simulation. So the first standard we're going to talk about today, and the standards used to be numbered. So if I say a number, I apologize, that's left over. They took the numbers off a couple of years ago to flatten the hierarchy because no standard is more important than the others. They're all equally important to get your simulation product. So that's where I may slip and say a number just so that you know. So today we're going to be talking about simulation outcomes and objectives. So all simulation-based experiences should begin with the development of measurable objectives designed to achieve expected outcomes. So we need to be doing purposeful simulation designed to meet an outcome. It might be a curriculum outcome. It might be a course outcome. It might be a short-term or a long-term outcome based on the objectives, which are measurable. So your objectives are what you're going to work towards and work with to meet those outcomes. All right, so do y'all remember our Menti from last time, our interactive questions? So here we are again. We love interaction and simulation in the NSTC. I see Leanne's phone. Yay, Leanne. Leanne is going to be the star of our little, I know. She's so willing to help. So thank you, Leanne, first of all. You're going to see, it'll make sense in a minute what I'm talking about. It's going to be wonderful.
So I got it, but I don't see where it just pulled this up. Where do I go after that?
What happened to me too?
You just wait right there. We're going to move to the next slide, and then it will change on your screen.
Oh.
Got it.
Oh,
Yes,
my bad.
Great. Thank you for that.
Is everyone ready to go to the next slide? Does anyone need more time? Abby, you're kind of dark. I can't see you.
It's because of all the light coming in the window. Sorry.
No, it's okay.
I'm so
I just
bright.
want to make sure you have plenty of time. Does anybody need more time? Okay, it looks like no. All right. Okay, so here's our first question for today. So what comes to mind when you think of simulation outcomes? You can put a word, you can put a phrase. First thing that pops in your mind, what comes to mind when you think of simulation outcomes? Student performance, goals for learning, metric or standard, critical thinking.
Are we clicking on it or are we putting it in the chat box? It doesn't look like it's working with me just clicking on it.
You're entering what comes to your mind. You're typing it in, what you think of when you think of simulation outcomes.
Nanette, did you open menti.com in your web browser? So you have to go to like Chrome or Edge and go to menti.com.
You can use your phone as well, if
Yeah,
that's
and
easier.
that QR code that was up there. Or just enter the code that you see on the top of the screen that's in the PowerPoint right now, the 2790707.
It's too quiet.
I know it is quiet.
We can go ahead. We have one more after this, so we can catch
Yeah,
up.
we'll go ahead. Okay. So, outcomes, simulation outcomes. So we've already talked about these. So critical thinking, goals for learning, metric or standards, student performance. And yes, so outcomes are always the end state. And a lot of times, you're familiar with Kirkpatrick's levels of evaluation. You hear that a lot with outcomes, especially in simulation. So Kirkpatrick has 4 levels, and they use alphabet versus number. So level 1 or A is reaction. So that's simply measuring the student's satisfaction with training. So the second level is learning. So measuring knowledge, skills, and attitude. So a lot of simulation is trying to achieve Kirkpatrick level 2 or B, which is measuring knowledge, skills, or attitude. So C in Kirkpatrick is behavior. So measuring changes that occur as a result of training. So think of an outcome at the end of a program. You want their behavior to actually change. And so then you would have reached Kirkpatrick level C. It doesn't happen sometimes in simulation because they're a one and done. But if you're thinking about a programmatic outcome, those can usually be achieved with Kirkpatrick. And then D are results. So that's actually improving quality and safety. And so that's actually usually mostly measured when someone is followed longitudinally. And so they've gone into practice, and you can see an increase in patient safety, and that is hard to achieve, Kirkpatrick D. And it's actually a great achievement if safety and quality are actually impacted. So remember that your outcomes for simulation, like we just said, they can be based on program outcomes, course outcomes, activity outcomes. So you have to really think about why you're doing the simulation. And then those outcomes are driven by your objectives. They can be threaded throughout the program, throughout the course. And most of the time we're looking at KSAs, I can't talk this morning, knowledge, skills, and attitudes of the participant. And if you think back to the Kirkpatrick we just talked about, that's B. So it all kind of ties together. All right, so here's our next question. All right, so what comes to mind when you think of simulation objectives? Smart, perfect. Measurable, objective expectation. Ooh, fancy. Measurable learning, fairness, verifiable knowledge. Perfect. These are all fantastic. And just like in nursing education, the recommendation is to use the SMART goals. And they actually come down from the CDC. So the CDC recommends the use of SMART goals, which I actually learned that the other day. I didn't realize that they had originated with the CDC. I thought that was very interesting. So your objectives are, like I said, what you're going to work with to meet your outcomes. And you want it to be fair, measurable. SMART is the acronym we all know. So specific, measurable, attainable, realistic, and timely. And a lot of us use those, and they're simple, but yet they're very, very hard. They can be hard to write and hard to construct, especially when you're trying to link them to an outcome and consider all the nuances that have to be gone together. Okay. All right, so this is just a nice comparison side once again, because there is a difference. So outcomes determine the impact of simulation-based activities, and you want your learner to perform at appropriate level. So what do I mean by that? I quit talking so much. What do I mean by that? Learner will perform at an appropriate level when it comes to outcomes.
Well, I think of banners, we use that a lot in our courses of what their goal is for that course.
Yep, Benner is always a winner. But what we mean here, the learner will perform at an appropriate level when it comes to outcomes, because remember, they can be programmatic, they can be course, they can be task specific. So if you think about maybe a course outcome, so your learner at your 6315 is going to perform different than your graduating senior, hopefully. You want them to perform at that appropriate level, so your outcomes should reflect that. Perfect. And we all know SMART, and we just went over this. Yep. All right, so here is just a visual representation for our visual conceptual learners. So I really like this. I think it's a nice way to put it. So you've got your SMART goal setting in the middle. You've got your bullseye. Where are you trying to go? Your goal. What is your goal? And goal and objective, are used interchangeably. And you can argue that they're different, and they can be, but for our purposes today, we're going to say they're the same so we don't muddy the water. So SMART goal or SMART objective setting. So specific, measurable, achievable, realistic, and timely. So of these, what do you think is the easiest to get incorrect when writing a SMART goal? What do you think is the easiest, slip up?
Measurable.
Measurable is challenging, especially if you're doing something subjective. What else? I can tell you the one that's hardest for me, but I'm not going to spill the beans yet. Which one of these I think is the hardest?
Achievable.
Yep, achievable. And that's the one I struggle with because I write these fabulous objectives and then I go, oh, can I really get this done in a 30-minute simulation? No, sometimes. Sometimes, yes, I do okay. But that one's the one I struggle with. What can I really achieve during my simulation? What are my objectives that will get me to my outcome? And what is my outcome today focused on? Is it focused on my simulation, my course, my program, my curriculum? So they all need to tie in together. Anybody else want to share?
I agree. Achievable is hard.
It is hard, very hard.
Because I have these thoughts that it can all happen.
Yes.
For 5 students in 2 hours. I thought that was a lot. It was challenging.
I agree. I know. Best laid plans, right?
Yes.
Yes. So, you may realize that, I wrote some unachievable goals and you may not until the end, and that's okay. The next time you do the simulation, you rewrite your objectives. You make them more achievable. It's not wrong. It just wasn't achievable. So it wasn't quite as smart as we thought.
I kind of think achievable and realistic kind of go hand in hand. And I feel like if you set a goal and it's not achievable, you might need to look at that next measurement. And so look at is it realistic? Realistic can tie back into the level of your learner. So maybe you have first year students and you also teach last semester students. And so sometimes you may overlap things and need to think about, is it realistic related to this level of learning?
Mm-hmm. I know, and I think about you a lot with 6315 and advanced health assessment because they have a bachelor's degree, but I forget that they don't know how to suture yet. I know that's a terrible example. I think that's a different course. Sorry. I just mixed that up.
It's so true. It's challenging figuring out.
Or they don't remember the landmarks and we, think, well, surely they know that. So it's not realistic because they don't even know the landmark. Right.
I'm sure there's a lot of new skills in 6315 that even though you're licensed, you're an RN, I wouldn't really know what to do for a prostate exam or a pelvic exam because that's not something I learned as an undergraduate.
Right. Or there's so many details and if you don't use them, you forget. I mean, let's just be honest. So, I always think that that's a challenging course. I think the procedures course is challenging too because you're building on prior knowledge, but everybody's prior knowledge level may not be consistent.
And then the whole thing with, like x-rays and ultrasound, and it's all new, all brand new. Not just reading a report.
Right. And so then you take that 6315 and if you try to put everything together in a simulation, maybe a culminating experience in the end, then I think that would be really a challenge. What would be realistic at the end of 6315 and achievable for a simulation that is timely, that doesn't take them 2 hours to show you, So it's interesting, but it's doable. And that's why we're all here, to help each other. Absolutely.
Well, it's one of the things that I realized after watching the last session with we design a lot of cases and we do a lot of activities and all that stuff. but really now focusing on, okay, so what, because there's so many things we want them to learn. And then, so it really kind of drove things home to me of really designing those objectives for the cases. And
You can always look at your course outcomes too and say, you know, how can I tie these in with my course outcomes? And that's what we're talking about today.
I love that. I love that conversation. I think what you just said, Sherry, I think is so important. We have these cases. Now we need to use them optimally. And one case can be used for one set of outcomes for one level student. And then the same case, like we want the first year student to pick out relevant history and physical exam and develop 3 differentials, where we want the second year student to develop an entire management plan. They still have to do history and physical, but the outcome is now different. It's a little more complex. We may use that one case, say, okay, interpret this x-ray, interpret this slice of the CT, interpret, this hemodynamic profile, or what medication is best for this patient in this hypertensive, hypertensive, short of breath, acute kidney injury patient. Or, you know what I mean? It's just that it can take little nuanced turns.
It can. And I love that idea because you start with a strong case and then it unfolds. And there's absolutely nothing wrong with that. And I think it's a good idea. It's a good use of faculty time too, because you have the base of the case, that rhymes, the case base built. We made a new word. And then you go from there and you modify your objectives smartly the whole time. So, yeah, great discussion. Shall we move on to the next one? Jessica was here and then she's gone. Where'd she go? There she's back. Hello.
Trying to come back.
Hey, Jessica. You went away.
Initially, we had the meeting for 10, so that's my fault.
I'm sorry, y'all. I really
okay.
And I joined on my phone initially because that's where I got the link. So now I'm on my computer and I'm ready to go. I apologize for the interruption.
It's okay. Not a problem. All right. So our next standard we're going to talk about is facilitation. And facilitation, in my opinion only, is hard. It takes art and it takes time and it takes practice. And you just start where you are and you build your facilitation skills. It really is a skill. I don't know how else to say it. So, but think about your facilitation. There's a couple of methods. So your facilitation methods really depend on your learning needs and your expected outcomes. And so as a facilitator during simulation, you assume responsibility and oversight of the simulation and manage the entire simulation-based experience. I am going to say however, though. However, the NSTC, through our accreditation process through SSH, we use and promote a 2-faculty model. So we have one faculty that does the simulation equipment and one faculty that focuses on the students, because we truly believe and evidence shows that you cannot successfully, depending on the fidelity of the simulation, now I'm going to say that, run the mannequin and the software and watch and evaluate and facilitate the students at the same time. It's a lot. So just keep that in mind. All right. Okay. So for effective facilitation requires a facilitator who has specific skills and knowledge in simulation pedagogy. So that's what we're currently doing. So this is what this professorship is all about. That's what the books are about that I gave you. Oh, and if you haven't gotten your book, I have them in my office if you still need them. I can't remember who needs them and who doesn't. LaTanya, do you have books? I can bring them down to you.
I do.
Okay, I can bring them down to you. I know Nanette does. She was the first one that came up.
I'll get mine when I come for health assessment next.
No problem. So you want your facilitator to have skills and knowledge in simulation. You want your facilitation to be appropriate to the level of learning, experience, and competency of the participants. And that's the hard part to me. It just takes time and practice. Includes preparatory activities and a pre-briefing. Utilizes cues to assist participants in achieving expected outcomes. But in a way, and again, that ties into the second bullet. To me, those go hand in hand. Your cues need to be appropriate to the level of learning, experience, and competency of the participants, and depending on if it's formative or summative. Dun, dun, dun. We should use some music. And it extends beyond the simulation event to support the participants to achieve the expected outcomes. What is the most common way that we do the last bullet? Extends beyond the simulation event. What do you think?
Debrief.
Absolutely. Debriefing. Yep. Perfect. Good job. All right. So look at this lovely video here. All right. So everyone, we're going to watch this video and then we're going to discuss. All right. So this is a final skills checkoff.
And I just add, feel free to take little notes. If you were the instructor doing this checkoff, like what would your facilitation look like? Keep that in your mind.
Good morning, Leanne. As part of today's simulation, we're going to be inserting an arterial line into the simulator. But I'd like you to use this task trainer instead, and I'd like you to perform that procedure now. Okay.
Yes, ma'am. So, Mr. Simmons, I'm Leanne, I'm a nurse practitioner student. I am going to perform your central line. I take it the nurse performed informed, had you to sign the consent. Were there any questions?
No, I don't have any questions.
Perfect, thank you. I'm just going to get dressed to make sure that you are safe and we prevent infection. I don't have the ultrasound machine, so I'm just going to do a blind stick, but I'm very good at this, so don't worry. It's okay if something touches a little bit, so don't worry about that either.
Hey.
Friend.
Hi. I'm on a Zoom.
Oh, well then I'll
Student.
Okay, I am going to ask my assistant to pull my mask out of my eye. Thank you. I don't want to contaminate the field. I will numb you up with a little bit of medicine. And first, I'm going to clean you. And I'm going to wipe you off. I'm going to fan you dry. Make sure you're good and dry.
All right. Now the video is paused here, but go ahead and get your feedback on how you would handle this as facilitating a final skill check off for a soon-to-be graduating student.
I guess I'm of two minds of it, I'll be honest, and I know I'm newer with this, but it's, there's obviously things that are wrong that need to be corrected, but then I also don't know if stopping the student is going to also make them more flustered. Is it better just to kind of keep that mental note and say at the end, okay, these are all the things we need to correct, let's do it again? That's where I am. I'm curious what other people's thoughts are.
Mm-hmm. And that's why we wanted to have this conversation. So student is fixing to graduate.
I
What do we
know,
do?
but I know.
No, that's okay. Let's hear from others. Because I think, I try not to give things away, but I can't help but spill the beans. I think there's several answers.
Mm-hmm.
All right. Should I call names? I like to call names if nobody says anything. LaTanya, what would you do?
Wow. So since my students do not do Central One, I would first start, did she do several techniques correct? She didn't. So what else? All the things I see typically, and this is me, I don't wait until the end. I address it right then. Because sometimes students don't realize, and at the end, they're like, oh, I didn't do that. But that's me.
So I actually want to interject for just a minute because we get that too. Well, I didn't do that. So we have the capability on the second floor, but we don't have the capability, but we could now via Zoom to record and have the students say, let's watch your performance.
Yeah, we had that at UL, and that was really, really a huge, yeah, because they don't know what they're doing. And then when you show them, look, this is how you got the even simple things, and then they're watching themselves and debriefing. It was very helpful. But I agree with Dr. Divins. I stopped my patients as soon as she broke sterile technique. I would have stopped and said, and I don't know if I'm doing it right, but that's what I've done in the past, because I feel like I don't want them to keep doing it wrong. I want them to realize the error and then correct or hopefully self-correct. So that's my 2 cents.
Mm-hmm. And like I said, and I think there are multiple answers. So the first question is, we didn't tell y'all enough information.
All right.
Is this formative? is this summative? If it's formative and it's a senior student, she's graduating next month, I would stop her. If it's summative, I would keep going and I would fail her and I would tell her why. And I also would use my debriefing skills differently for a summative experience when someone has failed and you give them feedback versus a formative when they're forming knowledge. Then you have a discussion with them. Well, tell me what you did wrong. Let's watch the video, blah, 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 blah. Because there's that nuance. And that's why I say I think facilitation is actually very hard. You don't want people to learn incorrect steps. So, but you also have to let them make mistakes to learn from those. So there's a fine art. So let's say then that this is formative and this is an end of student final skills checkoff and they've made all these errors. So now that you know it's formative and it's a senior student, would you do anything differently from that you answered?
The summative, I believe you mean, Allison, am I right?
I do, sorry. Why didn't somebody correct me? Thank you, Amy, earlier.
I think you only said that once.
You just said it
Said,
the last sentence.
yeah. So,
Sorry about that, y'all.
like she can make mistakes.
Yeah, absolutely.
Thank you, I can. Thank you so much.
Not senior year. They still make mistakes, but it shouldn't be as many. So what would I do on the summative? Well, I would stop and sit down and talk and say what's what. And then let's continue, start over. That's
I agree. I would have them stop and start over. So do you have them stop and start from the beginning? Or do you have them stop and start from where they made the mistake?
yes, beginning.
Beginning. I agree because you want them to form those skills and steps on how to do it right. I agree.
Are we still talking about a summative evaluation?
We're talking about yes.
Okay. So in a summative evaluation, I would not stop them.
I would
let them, I would keep them going.
I have it
I would.
I wouldn't stop them either in a summative. I would let them go and I'd really take detail about their performance and exactly what was missed or what was wrong and then explain it to them and have them sign that they didn't pass it especially if they're a senior.
Yeah, if it was summative.
Summative.
And we're thinking that all, intents and purposes, they had all the information they needed ahead of time. They don't feel like they were set up to fail. Because I have seen some
neutral.
I have seen very unintentional, but okay, here, this is what you have. When even for a student, that's not completely fair. What I'm saying is they still need some information, even if it's, not the answers. They still need some information to get started, to know what the expectation is. So as long as they know what the expectation is as a summative, I would not stop them. Now, what we have done in the past for formative evaluations, and I did this more in undergrad than in graduate. For graduates, I evaluate them individually, but we had the student audit their performance. So we did at one time when we had large classes, we would put one group of students, because if I had a clinical group of 10, I would have 5 in the simulation room and 5 in another room, and we would record. So we would have the students who are in the sitting room observing, we would have them take notes on specific standards. So in critical care, we use AACN's healthy work environment standards, and then we also used some CUSIN quality and safety standards. So for specific standards, we had a script, we had the standards, and did the students perform safely? Was there anxiety limiting performance? Was there, all of the standards of those? Communication, was it clear? Was it effective? Was it cordial? Was it respectful? Things like that. And so it is a situation where you definitely have to manage, because students can be more critical of each other than faculty. But it was interesting because the students also received it better from the students than they did the faculty. It felt a little bit safer than the grader doing it. So formatives, I would say definitely we would stop and we might start over. Again, it depends on the level. In critical care, we didn't stop them, but in health assessment, we did. And for my students in diagnostics and procedures, we do more task training and formative, whereas when they get to critical care and the NP, I don't stop them. I want them to go through the entire process. I want them to feel how long it takes. I want them to see all of the different equipment that they have to be comfortable with. I want them to sweat in all of that material. You know what I mean? I want them to feel it all. And
I agree, because we tell our undergraduate students to do everything as real as possible. And that's why when we filmed this simulation with Leanne, we said, please do it as real as possible. Go through every step, dress out completely. And I think that's really important because they take those skills into practice. And the more times, remote memory that you do it, the better. And so, yes. So sorry for the confusion of words there, but yes, formative versus summative. All right. So great discussion.
I had a quick question. How hard was it, Leanne, to break your sterile technique when you were doing that?
Listen, they asked me, should I give it away? Can I give it away?
Not yet.
Oh, no,
okay.
not yet.
Never mind.
Not yet.
Never mind.
Hold that thought. Okay, let's move to the next one because I'm looking at the time.
All right, so this is going to continue the video, but we're thinking formatively at this point as if this is a first attempt of return demonstration of a skill for a new graduate student.
I don't know what that is. We're not going to use that. Oh, I do know what this is. Sometimes they use backwards, so all kinds of stuff in our passport and the passports.
I couldn't hear that. What is she saying?
She's talking about, I know what some of these medications are. Sometimes they put stuff in that I don't need. Out loud to the patient. Oh.
I like in the first one, she assured the patient she was really good at it. I like that.
Because she didn't have the ultrasound, but she doesn't need it. She's really good at it.
She got that.
Yeah.
Oh, mask again.
There's no need for me to wait because I want to make sure that you don't feel it. We have a better older pulse, so let's just go there.
Could y'all hear what she said?
No.
She said they have a better ulnar pulse, so she's going to put it over here.
Yeah, she would have already been interrupted a bunch of times. Like, she wouldn't even be as far as she is right now. She'd be in timeout somewhere.
I thought she was doing a central line.
No,
That's very good. She did tell the patient she was doing a central line, and we are doing an A line.
Yeah.
That's concerning for that first video with that senior student who's graduating. I hope they know the difference.
Yeah.
So that would be an excellent debriefing point.
Yeah.
How could we, write for something? I guess we need an FOA, but I would love to have that video available. That would just be so amazing. No? Y'all don't want the video? Nobody wants it? Okay.
Okay. So we've kind of talked about it already. So this is our new student. This is the first time they've ever done a skill. And I like the way Jessica said that she would already be in timeout a long time ago.
Yeah.
Yeah.
Because unfortunately, our student has done a lot of things incorrectly. So Leanne, now you can answer the question that Abby asked you.
I forgot the question.
How hard was it to do it so wrong?
Oh, like I had a plan going in. When I was told, I was like, okay, but trying to because I had a student do this, not with an art line, with a chest too. And she was like, but I was reassuring. And I'm like, shut up.
I figured you enacted.
I didn't say that.
I figured you enacted a statement you had seen.
Yeah.
Right. So if this was the first student, the first attempt ever, when would y'all have first stepped in with a formative assessment of this student? When would you have stepped in?
For me, early.
Early. Mm-hmm. Yep. Agree. Yep.
If it's their first return demonstration, because I think that's what you set it up to be, right? They're doing it for the very first time. I mean, you wouldn't let them go that far. You'd be right there with them, doing it with them, teaching. I mean, after the first try, they're not going to get it usually. Right. Not something this complicated.
And we didn't set the scene on purpose very well, but it was hard to hear in the beginning. My directions are, as part of our simulation today, we'll be using this task trainer. So, this could be, a trauma simulation. And so the student's nerves are already up or the adrenaline is up. So there's things different nuances to think of too. Or it could be a really low key. I don't think anyone comes in for a routine art line or a central line. So Leanne says no. But, if you're using a task trainer and let's say you're doing something with peds with Melissa and you have someone coming in for stitches that you might need a task trainer for. I could see how this would be applicable because you've got a high fidelity sim potentially going on with a little bit of trauma with a peds patient and they end up needing stitches in something. So it's just a different way to think and to combine your fidelities together. Does that make sense?
Mm-hmm.
Perfect. All right. So very good. Very good. And like I said, there's a lot of, there's not a wrong answer. The right answer is what your gut tells you to stop the student, not stop the student, redirect them, have them restart, or depending on the level, let them keep going, tell them they have been unsuccessful with the skill and tell them why. So there's all different, like I said, the formative versus the summative versus the level of the student. So, and it just takes skills and practice.
And translating the simulation that we just saw, say, into a high fidelity sim environment, say where you've got faculty is the facilitator pretending to be the doctor or the other healthcare provider, and someone is running the simulator. Maybe you wouldn't interrupt that, but that would be an opportunity to use cues to help redirect the student in the right direction. I wish we had had time to do one of those, but I just wanted to make that point that that's where cues, rather than directly intervening, might give the student an opportunity to access the knowledge that you're looking to evaluate.
That's a good
really
point, Amy.
That is a good point.
Yeah, especially in your earlier students. And I guess I want to get a pulse on what will be our philosophy for evaluating the NP students. Like, I really want us to have good inter-rater reliability, even though we're across concentrations. Because if we can adapt to a philosophy and all be on one accord, then that will help student behaviors and student performance. So if it is a later student, then I would think we should use cues less. If it's an earlier student, then we may need to use cues more. And sometimes earlier students won't even pick up on the cues.
Sometimes
but
the
if,
cues with an early student almost become guidance, and that's okay too.
yeah.
Sometimes it's just the look on your face that's a cue to them.
But but that has to be, I really have to watch that. That's something I have to get better at, because I'll have that, did you just do that face? But we really shouldn't, because they look to our nonverbal as a cue. They look to our nonverbal. So we should be neutral. We should be as neutral as possible until we get to even in the debriefing.
But
that's a great point.
That's a good facilitation skill as well. And it's okay in pre-briefing to tell your students, I am here, but I am not here. I'm only observing the simulation, and I will speak if I need to. Treat me as a ghost. It's okay to pre-brief and say that. Yeah. So cueing is definitely a skill, and I'm glad you brought that up. Absolutely. Yeah.
And we use cueing a lot in the undergraduate program because we do facilitate simulation with that 2-faculty model and actually have the force faculty there to observe the student. And with our high fidelity simulations with undergraduate, with the software that we use with our MediMin and HBS, they really have several states where things are constantly changing. So that makes it very difficult for one faculty to observe students and operate the software. So tying back into Amy's cueing, we've had to use cueing where we involve the actual simulated patient. So in pre-briefing, I tell my students, if you need to communicate with your patient, ask questions, you may hear my voice come out of the simulator in response to your questions to the patient. So just to give you an example of cueing, in our PED simulation, after the student started the IV, they didn't remove the tourniquet and attach the IV fluids. And so the child started complaining, my arm hurts. Why is that thing so tight on my arm? And so that cued the patient without me stopping and saying, okay, what did you do wrong? Let's stop here. The patient brought that to their attention, and it was almost like it was part of the simulation, and we were able to keep moving forward with that correction happening.
I agree. So just, reflect back on simulations you've done, or, we can always dry run things. We can simulate together. We can watch Leanne's video. So good. Thank you, Leanne.
The first video I did, that's what you should have shown. We did with me, Todd, Jen.
Oh, I've seen it. I've seen
It's
it. The critical
actually
care
not-
video. I love that. It's a classic.
It's not bad. It's a classic. So I'm looking at the time. It's 9:59. So what I would like you to do on your own time is really I challenge you. Take the SMART sheet that Sherry sent out. Look at a simulation that you already have constructed and check your objectives. Are they SMART? On your own. But as I always say, the NSCC, we are always here. All three of us, our doors are open, anytime to help. And so just think about that moving on. So the next time we meet, which will be it seems to be every other or every 3 weeks, just depends on the calendar and how busy things are getting, because it's kind of getting towards the end. So the next standards we'll be looking at is debriefing, and we'll probably look at that on its own because it's such a large topic. So next time, get ready for debriefing. All right. Do y'all have any questions or comments? I'm looking at the time. It's 10.
I do.
Yes, ma'am.
I could not see the first one. You guys didn't. Leanne sent me the link. It didn't work.
Did it ask you for a password, Latanya? It's frustrating because in the link, the password is like typed into the end of it, and it always tricks me. I always click on the link and forget. And then if I highlight, copy, and paste the password, It adds a space on the end.
Is that what it is?
Yep. So you have to backspace 1.
Okay. Because I'm like, I keep pressing it and putting in the code, but it's not working.
I didn't get to see
It's
the
all
first
these
video.
little things with Zoom.
Yeah.
Okay. Is
All
there
right, thank you guys.
anybody? Anything else?
It was great.
Wonderful. Y'all have a great day. Thank you.
We
Thanks, Lee.
appreciate you. Our ladies are going to stay on for Jessica